Hello, my name is Jessica Cooks, and I am the nurse practitioner student who will be completing an HEENT head, eye, ear, nose, and throat exam today. Before we begin, I would like to get consent from my patient to complete the exam and record a video on YouTube, which I will upload for my professor and possibly other professors and students to see. Before we begin, do I have your consent?
Yes, you have my consent.
Thank you. I have completed hand hygiene and I'm going to begin with inspection. I can see that the hair is evenly distributed with no balding, flaking, or dandruff. The hair texture is normal and the head is without rashes or lesions. Is it okay to touch?
Yes.
Okay. I am going to palpate the head. I see that the skull is atraumatic and normal cephalic. There are no cysts, there are no depressions, and there are no lesions or hematomas. Thank you. Do you have any headaches or do you experience any dizziness?
No.
No. Have you ever had any head injuries?
No.
No. I'm just going to palpate the temporal artery. Any tenderness there?
No.
There's no bulging or tenderness of the temporal artery. Okay, and thank you. And now we're going to move on to the eyes. I'm going to start by generally inspecting the eyes. From checking position and alignment, I do not see any exophthalmos or strabismus. Do you have any problems with your vision, any blurred vision or challenges seeing or reading?
No, none of the above.
Okay, any itchiness or redness in your eyes?
No.
No, and I can see that the upper and lower eyelids, they fit smoothly across the eyeballs with no ptosis. There's no inflammation and there's no redness. And I don't see any edema on the eyelids as well. Okay, I'm going to touch again. I want you to look up. I'm going to press down. Okay, the sclera is white, the conjunctiva is pink, and it's vascular and it doesn't cover the cornea. The lacrimal system is without any tearing or excessive dryness, and there's no swelling of the lacrimal sac. And I can see the cornea is clear, bright, and smooth. And looking in both eyes, the iris is similar in both eyes. And there's no prolapse or any problems of the eyes. Okay, and I am. Okay, so we're going to move on to check your visual acuity. Since I am using the pocket Snelling chart, I am going to position myself 6 feet away from the patient. We're going to use this card. I'm going to have you cover one eye at a time using the card.
Okay.
Okay, so can you cover one eye? And I want you to read the lowest line here that you can see.
LTFPH.
Okay, and can you cover the other eye? You can read the lowest line you can see.
LTPFH.
Okay, and now with both eyes, can you read the lowest line you can see?
LTFPH.
Okay, thank you. I'll take that. And now that we're done checking visual acuity, which the patient read at 20/20, it appears to be 20/20 in both eyes, we're going to check your visual fields by confrontation, being arm's length away from the patient. I'm going to move my hands about 2 feet apart. And what we're going to do here, I'm going to cover my left eye. You cover the opposite eye. You can just close your right eye. And I'm going to move my fingers. You tell me when you can see my fingers. You ready?
Yes. Now. Now. Now.
Okay, and now I'm going to cover my right eye and you cover your left eye. And we're going to do the same. With the wiggle test, you tell me when you can see my fingers.
Now. Now. Now.
Okay, and now you can open both eyes. I'm going to use this pen light. It's a bright light. I'm going to shine on your eyes to check your pupil reaction. I'm going to start with the left eye, and I'm going to shine it directly on your eye first. And I can see that the pupils constrict from 3 to 2. And I'm going to shine it one more time. And when I shine the light on the left eye, I also see the right eye constricts. So now we're going to check the right eye. I can see the right eye constricts from 3 to 2, and I'm going to do it one more time. Sorry. And I can see that when I shine the light in the right eye, the left eye also constricts, which shows me that the pupils are equal reactant to light directly and consensually. Now, the next thing I'm going to check is the oculomotor movements. By doing so, I will check cranial nerves 3, which is oculomotor, 4, which is trochlear, and 6, which is abducens. Okay, and also while doing so, I'm going to check accommodation, convergence, and nystagmus. The first thing we're going to do is check for involuntary eye movements. I'm going to check the 6 cardinals of gaze. I want you to focus your eyes on the pen light and just follow the pen light only with your eyes and do not move your head. Are you ready to begin?
Yes.
Follow the pen light. Good. Good. Okay, and we can see that you're able to follow the pen light, and I do not see any nystagmus. And now I want you to look at that object which is in the near distance, the door there. And now I want you to look at this pen light. I'm going to bring the pen light closer to your face, and I want you to continue to follow the pen light with your eyes. Do not move your head, okay? Just follow with your eyes.
Mm-hmm.
Any blurred vision?
No.
Okay, any pain in your eyes?
No.
Okay, so convergence is intact, and from doing these exams, we can see that the pupils are round and equally reactant to light and accommodation, and that's both directly and consensually. Okay, and next I am going to move on to further examine your eyes by using this, which is the ophthalmoscope. So I'm going to get in close to you with this part of the exam.
That's fine.
So by starting, I'm going to dim the lights. The lights are dimmer. And then I am going to come in at a 15-degree angle. I'm going to put this light in your eye. And I'm placing my right eye to the patient's right eye, holding the scope in my right hand. And I place my hands around the scope this way, using it as a brace so that when I lean into the patient, my nose or face doesn't bump the patient. And it's just a safety measure. And it also gives me the angle that I'm going in, a better view of the fundus, okay?
Yes.
You can come in closer to me, thank you. And I'm gonna place my head over your head. Okay, I see a clear lens and the red reflex, and I'm gonna move in closer, just the light. Okay, I can see the optic disc, the optic nerves, and the vessels. The disc and margins are sharp. The cup to disc ratio is 1 to 3. Okay, the retina is bright and orange. And I do not see any cotton wool spots or exudates. And I don't see any AV nicking or any other trouble with the vessels. And that is in the right eye. We're going to do the same with the left eye. I'm going to position my left eye to your left eye and put the scope in my left hand. Okay. And moving in again, I see a bright lens, even red reflex on the left eye. And I can see the optic disc margins are sharp. The cup to disc ratio is 1 to 3. There is also a bright and orange retina on this eye. Also, no exudates or cotton wool spots. And there is no AV nicking or other problem with the vessels. Thank you. Okay, and do you have any drainage or any problems like that? Have you had any eye infections?
No.
Okay. Next, we're going to move on to inspect your nose. I'm going to start with the general inspection of the nose. And I can see that there is no redness or malformations on the outer nose. Is it okay to touch?
Yes.
Any tenderness?
No.
Okay, do you experience any runny nose or stuffiness or congestion?
No.
Okay, any pressure anywhere in your face?
No.
Okay, as I palpate the nose, I'm also going to palpate the frontal and maxillary sinuses. There's no pressure or tenderness. And we're going to use the otoscope as a light source to inspect the nose. I am going to use a clean speculum, and with this speculum, I'm going to examine the inside of your nose, okay?
Yes.
You can tilt back. I'm going to hold the bridge of the nose for balance. Okay. I am looking into, excuse me, can you bring yourself a little closer? Perfect. Looking into the nose. The mucosa and turbinates are pink, moist, and intact. Okay, there's no inflammation or lesions, and the nasal septum is midline with no deviation. And I'm going to assess the right side now. On this side, the mucosa and turbinates are pink, moist, and intact. There's no drainage or inflammation. And we're just going to dispose of that speculum. And now we're going to check your airflow and your smell. So what I'm going to have you do is to place your finger to occlude one nostril. Breathe in. Good. Can you do the other side? Okay, good. There's no interruption of airflow. And can you please close your eyes? I'm going to have you inhale, and you can tell me what you smell. What do you smell?
Coffee.
Okay, well, there is no disruption of airflow and the smell is intact. Okay? And now we're going to move on to the ears. So I am started by inspecting the external ear. I can see that the ears are evenly aligned. Can I bring you closer to me? And you can turn sideways. So I can see, I'm going to palpate the ears and the targus. Any tenderness?
No.
Do you experience any ear aches, ear pain?
No.
No, and there's no discharge from the ears and no redness. Can I check the other side?
Sure.
I'm going to palpate the external ear and the targus. Okay, and you can sit back. And now we're going to check the 8th cranial nerve. I'm going to check for gross hearing by checking auditory acuity. If we were in the exam room, what I would do is move out of your vision, and I would whisper a word, and we would occlude the ear. You would tell me what you hear. In this particular case, I'm going to have you turn your head, and I'm going to occlude your ear. I'm going to whisper a word, a 2-syllable word, and you can tell me what you hear.
Apple.
Okay, and can you go that way? Baseball.
Baseball.
Okay, so now we're going to move on to two different hearing tests, the Weber and Run. Using the tuning fork, we're going to start checking conduction with the Weber test. I'm going to strike the tuning fork, place it on your forehead. Okay, do you hear ringing on your left or right side?
Both.
You do hear on both sides, which is the expected response. There is no lateralization on either side, so that is the normal response. And I'm going to strike the tuning fork again and place it behind the ear at the mastoid bone. Let me know when you don't hear the ringing.
Stopped.
Okay. Do you still hear the ringing?
Yes.
Okay. So with the rhyme test, that lets us know that the air conduction is greater than the bone conduction, which is the expected response. I'm going to check on the right side. Okay. Let me know when the ringing stops.
Stopped.
Can you still hear it?
Yes.
Okay. So on both sides, the expected results were achieved. So that was the Weber, and the Rhine test. And I'm going to, give me 1 second. Okay, so now we're using the otoscope. I'm sorry, just getting the otoscopes together here. So we're using the otoscope to examine the external ear. We have changed, this is a clean speculum. Okay, and as we're examining the internal ear, I'm going to pull up and back, and I'm going to use my hand to brace against the patient's face so that the ear doesn't move. The speculum doesn't go too far in the ear and cause any damage. Okay, we can see the tympanic membrane. It is pearly and gray. It's shiny. And I can see the cone of light at 5 o'clock, which lets me know I'm in the right ear. Okay, and we're gonna go ahead and do the same on the left. You can look that way. I'm gonna pull up and back and use my hands not to go too far. We can also see the tympanic membrane on this side. It's pearly gray and it's shiny, it's translucent. And on this side, the cone of light is at 7 o'clock, which lets me know I am looking in the left ear. So now we're moving on to the mouth, the throat, and the face. I'll start with general inspection. The face is symmetrical. I do not see any discoloration or lesions on the face. Can you smile? Okay, there's no facial drooping and no asymmetry when the patient smiles. And I am looking at the face. I see the eyebrows are evenly distributed and there's no foreign bodies present. Okay. The lips are pink and moist. And I'm just gonna have you open your mouth. You don't say ah or anything, just open. And I'm gonna examine the buccal mucosa. You can, okay, using the tongue blade, I'm gonna look in. Okay, good. Okay, I don't see any lesions. The tongue is midline, the papillae is present. The tongue is average in length. Okay, can you open again? Can you hold your tongue up for me? There are no lesions under the tongue. Okay, and now I'm gonna look at the hard and soft palate. You can brush your mouth. Ah, you can say ah. Okay, and I see the uvula is pink in midline, and when the patient goes ah, the uvula moves forward. I'm gonna have you open again. I'm gonna check your gag reflex, okay?
Okay.
Are you ready?
Yes.
Okay.
Ah.
You don't have to go, I'm sorry. I'm sorry. Thank you. So the patient's gag reflex is intact, as you can see. And can you swallow for me? So cranial nerves 9 and 10 are intact. As noted by when the patient goes ah, the uvula moves forward as expected. And then the patient is able to speak, as we can hear, without hoarseness, and the patient is able to swallow. So the cranial nerve 10 is intact. And I'm just gonna put this away. Okay, and now we're gonna check your cranial nerve 2. Can you open up for me? Move your tongue side to side, good, and up and down. Cranial nerve 2 is intact. Okay, and just looking at your mouth, have you ever had your any problems with your tonsils being inflamed or any throat infections?
No.
Okay, so when we look into the mouth, there's no protrusions of the tonsils, there's no exudates, and the posterior pharynx is without arrhythmia or exudates. Okay, any sore throats or anything like that?
No, not at all.
Okay, good. And looking into the mouth, the teeth do not have any dental caries, thank you, and no missing teeth or no deformities noted, and the gingiva is intact with no inflammation. All right. And now I am going to examine your neck. The neck, thank you. The neck is supple.
Oh, sorry.
It's okay. Okay. The trachea is midline. There's no lesions, no visible quarter. Can you swallow? Okay. And now I'm going to check your range of motion. You can follow along with me. I'm going to have you hyperextend. You can tilt your head back. Good. And flex. You can bring it down. Very good. And now you can turn your side. That's lateral. The other side. Any pain or discomfort?
No.
Good. Now I want you to rotate. Good. Any pain or discomfort?
No.
Okay, the range of motion is intact. And now I want you to turn your head that way and tilt to the side just a little. Okay, there's no jugular vein distension noted. And turn your head towards me. I'm going to press. We're going to move against resistance. Can you start over? Keep your head that way. Now turn. Good. You can move against resistance. And now I'm going to place my hands on your shoulders. I want you to shrug your shoulders, but I'm going to give you some resistance. Okay, perfect. You can move your shoulders against resistance. So these two things show that the spinal accessory is intact. Okay? So do you have any pain in the shoulders or pain in the neck?
No, not at all.
Okay, so now we're going to move on. I'm going to palpate the lymph nodes. I am going to start, I'm going to touch.
Okay.
I'm going to start with the periauricle, and then I'm going to do the postauricle, and then I'm going to palpate the occipital, and the anterior cervical, and then the posterior cervical, and the supraclavicular. So when I'm doing this, do you feel any tenderness or pain?
No.
Okay, no tenderness anywhere with the lymph nodes, and the nodes cannot be felt. I'm sorry. Okay. Thank you.
Mm-hmm.
Okay. And now I am going to check your thyroid. So I did have you swallow. That's a part of looking at the thyroid.
Mm-hmm.
We can see that there was no visible quarter, but I'm also going to palpate a few structures.
Okay.
I am going to start at the mentalis muscle, and I'm going to move my hands down to the first hard structure I feel, the thyroid cartilage here, and then I'm going to bring my hands down to the cricoid cartilage, and then I feel the first two rings of the trachea, and I am going to move behind the patient. I apologize.
Mm-hmm.
So I'm going to reposition my hands, coming back to the first two rings of the trachea. And I'm going to flatten my hands, and this is where the isthmus of the thyroid lie. I'm going to move slightly to the side. Okay, can you swallow? And I'm looking to see if either hand rises more than the other. In this case, they do not. Okay, can you swallow again? Okay, and I'm going to push the thyroid gland over and palpate the lobes. And I'm going to push it over and palpate the lobes. Okay, any pain or tenderness there?
No.
Okay, and that completes my exam. Thank you for your participation. Thank you for watching.